Hello, I'm Professor Mike Wells from the Division of Emergency Medicine at Wits University in Johannesburg, South Africa. I would like to give you some background on the PAWPER tape as well as to explain how to use it correctly and safely. Let me say right at the beginning that the PAWPER tape is not a commercial venture. It is not for financial gain, but intended rather to improve emergency medical care for children. Since almost all drugs used in children have doses based on their weight, it follows that an accurate estimation of weight is needed when an actual measured weight cannot be obtained. Variations in body size and body habitus between children means that unless a weight estimation system takes this variation in habitus into account, it will be dangerously inaccurate. Unfortunately, most of the existing methods of weight estimation for children, such as age-based weight formulas and the Broslow tape, lack sufficient accuracy to ensure safe and appropriate drug therapy. They should not be used as they may result in patient harm. In addition to being inaccurate, formulas are also difficult to remember and difficult to use in emergencies. The Broslow tape, despite being better than formulas, is dangerously inaccurate in underweight and obese children and is very expensive in South Africa. So let's get to the PAWPER tape. It was developed in 2007 and it was the first of the two-dimensional length and habitus-based systems. It was also the first tape system to incorporate weight modification methodology based on body habitus. This dramatically improved the accuracy of weight estimation when compared to using length alone. It was also designed to be quick and easy to use with minimal thinking time. It provides a weight estimation in 2 easy steps, which we will demonstrate in a minute. The first step is to use the PAWPER tape to measure the child's length in a straight line from head to heel. The correct weight segment on the tape is identified where the child's heel crosses the tape. The second step is then to assess the child's body habitus and to assign what we call a habitus score. This is a score from 1 to 5. On the habitus score scale, a habitus score of 1 represents a very thin child and 5 represents an obese child. The average child that is not underweight or overweight would represent a habitus score of 3. This score is assigned based on a rapid visual inspection of the undressed child and a gestalt impression of their habitus. Use words that come to mind when you assess the habitus. Habitus score 1 would be thin, scrawny, underweight, extra small, and so on. Habitus score 2 would be slim, petite, slightly underweight, or small. Score 3 would be average or normal or medium. Score 4 would be chubby, overweight, chunky, or large. And habitus score 5 would be obese, fat, or extra large. Each segment of the PAWPER tape has a weight that corresponds to each habitus score. This weight can be read off the tape and used for drug dose determinations. Note that I didn't say calculations. Calculations are not reliable or desirable during emergency medical care. It's already difficult enough to manage the medical aspects of resuscitative care without having to calculate drug doses and dilutions and volumes to administer. The PAWPER tape has no drug information on it because it was designed to be used with a resuscitation aid to provide this information. A resuscitation aid will decrease the cognitive burden on the resuscitating team rather than adding additional stresses. This aid must contain complete information on drug doses and preparation. We would recommend the flipper card or the emergency drug dosing in children book. Let's now look at the PAWPER tape in action and see some more about habitus score assessment.
Begin by measuring from the top of the child's head with the start of the tape, which says measure from this line. Ensure that the tape is directly in line with the top of the child's head. Extend the tape towards the child's heel. The weight segment in which the child belongs is read off the tape at the point where the child's heel crosses the tape. Check that the tape is laid out horizontally and does not contour to the child's limbs. This is being demonstrated from the opposite side of the examination bed, but measurements are usually performed holding the tape on the same side of the bed as the healthcare practitioner. This child, as can be seen from her slim, petite physique, has a habitus score of 2. As she falls into the 28 kilogram weight segment, with this habitus score adjustment, her estimated weight would be 26 kilograms. Habitus score 1. Thin. Clearly visible ribs and thin shoulders. Virtually no fat. Very poor muscle mass. Habitus score 2. Lean. Chest larger than abdomen. Flat, clear waist present. Thin, but muscles defined. Habitus score 3. Optimum. Average. Smooth layer of fat around the abdomen. Well-proportioned limbs. Good muscle mass. Habitus score 4. Slightly overweight. Smooth fat layer over ribs. An abdomen larger than chest and very rounded. Noticeable thickening of limbs. Habitus score 5. Overweight. Rounded fleshy face with big cheeks. Fatty breasts visible. Thick layer of fat on the abdomen and abdomen much larger than chest. In summary, Step 1. Measure the length of the child. Step 2. Assign the body habitus score and read the weight off the tape. Always use an appropriate resuscitation aid during emergencies. Weight estimation in emergencies is not to be taken lightly. Find us on facebook.com/PAWPER tape.